Candace, welcome to Health Datapalooza.
Thank you for having me.
So, we're here at Health Datapalooza, and one of the things that Atrium Health is really passionate about is to work with a number of constituents across the board. It's not just about a health system like us gunning for change. It is really about us working with the right stakeholders, public, private policy, but also patients. And it's for that reason that we're proudly sponsoring the patient scholarship here at Health Datapalooza this year. And it's such a pleasure to have you here under that scholarship. And so thank you for being here.
Well, thank you for having me. This was an honor to be selected and to come here, especially as a rare disease patient. And a little bit about my journey. I was diagnosed with a rare blood disorder called ITP in 2014, and I ended up doing my own research and repurposing a drug off-label that put my rare disease in remission. And I wanted to pay it forward after I did that, so I went to law school, graduated in 2.5 years, became an attorney, then got a scholarship to get my healthcare compliance certification as well, so I could work in healthcare compliance and really dig into the policies and the business side of things to help patients. And so when I saw the opportunity to apply for a patient scholarship to come here, I was super excited because my journey has relied so much on patient data coming from my friends with my disease, and I would not be alive today had I not gotten their data so that I could convince my doctor to repurpose this drug to save my life.
That's fantastic. And we're really glad that it sounds to me like you're doing better from a health perspective.
I am. Unfortunately, I found out 2 weeks ago that I am out of remission, so I'm going to have to repurpose the drug again. It's created a different set of challenges because now my doctors are starting to examine, is it safe to use this drug again? Because ultimately I'm tanking a section of my immune system that we rely on to fight off foreign invaders and viruses and things. So I am on a new expedition now to find patients with my same disease who have used my drug more than once with success so that I can show my doctors that there is a pattern of positive results, and then they will feel comfortable using the drug again.
It's really interesting. So I'm a physician by background. I'm a radiologist, and at Atrium Health, I'm actually charged with strategy. And one of the things I always believe is in the power of co-creation. Right? It's interesting. This field of medicine is as much of an art as it is science, and with the unknowns that exist out there, there's just so much. There's a lot of evidence-based guidelines, clinical best practices, protocols, but there are also a lot of unknowns, especially around the realm of rare disease, for us to able to co-create and co-discover and partner together with patients like you who are engaged and motivated, but also at the same time really understand the value of working together to find the right solutions, not just to help yourself, which is really important both for you as well as for me and for our system, but also for other patients like you, and to then be able to scale that at a level that will really benefit the for all. So one of our things that we're really proud of at Atrium Health is our mission statement. It's health, hope, and healing for all. And that for all element is something that, really gives you pause when you think about how do we co-create, how do we make sure that we really work. So let's talk a little bit about that co-creation process from the angle of data, because we are at Health Datapalooza. And when we look at rare diseases and when we look at the specifics of how do we co-create, the data element becomes really, really important. So talk to us a little bit about data and some of the trials and tribulations, challenges, but opportunities that you've seen around data.
So rare disease data is very difficult. So coming from a patient perspective, there isn't much information or data out there about my disease and about patient outcomes for my disease. So I really have to rely on real world evidence in a way and reaching out to fellow patients and having them tell me something in a less than clinical matter. Let's just say like, hey, I took this drug and I feel better. And I have to trust that that may happen for me, or that's the outcome without a scientific explanation. On the other end, as both an attorney and somebody who works with drug development, it's very difficult for me to perceive a drug getting through the FDA and being approved because we're dealing with such small data sets. And the FDA generally is looking and geared towards more larger population sizes and data sample sizes. So we're ultimately building data platforms and analyzing data in two groups. We're in the rare disease group where we're using microdata, and then we're in the large disease group where we're using macro data. And I have another autoimmune disorder, Sjogren's syndrome, which is a common disorder. So when I'm looking at the data and analyzing it from that perspective, there's lots of information out there for me to look at. But when I'm looking at my rare disease, there really isn't that much there. And so I think what really kind of fills in the gaps are the patients that are engaged with that limited data set, because they're filling in the blanks. Maybe we don't have that large sample size, but we have the patient real world experience that's able to come to the table and tell clinicians, hey, this is what we need to fill in, or we're just going to tell you this. You may not have a statistic for it, but it works.
That's really important. The real world evidence, as you put it, is really critical in helping influence the direction of some of the things that we're actually discovering and co-creating and co-discovering. So let's end by talking about where we are, which is we're at this conference, which is really the confluence of public, private, and policy, as I described earlier, but also patients. And when we're able to really go to the fringes, get out of our comfort zone. As a clinician, the way that I was taught was we go to clinical meetings, we talk about evidence-based guidelines, and we talk about what's worked and the tried and tested, and we learn from our peers through peer review processes and all of that. That's great for clinical progress and advancement, and that's how evidence-based guidelines came to be in terms of how they are today. Same thing with policy meetings. Policy meetings are sort of their own echo chamber. Same with IT meetings, and patients also congregate, and you have groups of patients that talk about their issues. But the opportunity that I see here at the Health Datapalooza is really for the multiple different stakeholders to come together and have that engaging dialogue, right? So for someone like you who's gone through so many challenges. I know you're very passionate about, for example, earlier we were talking about the Open
Act,
Open
yes.
Act, right? To be able to push the specifics of that forward, and that takes a level of engagement, not just from champions like yourselves that have lived through, as you described it earlier, the trials and tribulations of what caused you to put the synthesis of the Open Act together, but also legislation and the folks in policy, but health systems like ours and others that would end up supporting you and wanting to be part of that participatory care that goes into solving some of these challenges. So talk to me a little bit about the Open Care Act, or the Open Act, is it? And what that's about, and some of the challenges that you've had, but also perhaps the opportunities if we're really able to come together in a forum like this to sort of push this forward.
Absolutely. So what the Open Act does is it would provide a small incentive to pharmaceutical companies to run clinical trials for rare diseases using products that are already on the market for another indication. So ultimately, we already know the drug is safe for human consumption, but we want to know how it reacts to a patient with a rare disease, get it on label, which will help patients not only have access to it, it will help physicians be able to provide informed consent on the actual drug and how it will interact with the patient, and it helps with insurance coverage. So payers will be aware that this is a possible therapy for patients. I've had a lot of challenges with it because a lot of people don't know, especially politicians, about how repurposing drugs can help rare disease patients. Because we're rare, even though we're 1 in 10 Americans, there's 30 million Americans with a rare disease, unless you talk to somebody and you know somebody personally with a rare disease, you don't understand the struggle. And there's nothing scarier than being told that you don't have an FDA-approved drug for your illness, because I spent 27 years of my life before I was diagnosed, and anytime I got sick and went to the doctor, they wrote me a prescription and I was fine. This was the first time I went there, and everybody kind of just scratched their heads, and some people kind of gasped and went, oh, we don't have anything for you. So the Open Act would kind of fill in the blanks, and it provides the incentive. It helps people understand, especially industry, that they can have a product that can help people. But at the current rate of new drug discoveries and orphan drug development, it would take almost 466 years to get a drug for all 7,000 rare diseases. And we don't have time to wait.
No.
So this would fill in the blanks. It could provide up to probably 500 new drugs, looking at all the repurposing and the data. But the really nice thing is that if we repurpose a drug and we get the data for it, and health systems can contribute by reporting back as to what their patients are using or how they're using it, we could also develop new therapies, better therapies with less side effects and less just issues with quality of life for patients. And I think that's where we can come in and improve medicine in a radical way, and this bill is just the beginning.
Yeah. Well, thank you. Thanks for sharing the specifics of the bill. It sounds really promising. It sounds really remarkable. And what shines through everything that you just described is your passion, because you've lived through it. You know the hardship of not having the specifics of what you're trying to get at there. But it's through these conversations that we really try to push the specifics of this forward. So let's continue to have these conversations. Thank you for your partnership. Thank you for coming to Health Datapalooza. But most of all, we wish you well, and we wish you good health. And if there's anything we can do as a health system, let us know.
Thank you so much.
All right, thank
you.
Thanks.